Dr. Maya Edgar from Edgar Family Chiropractic here. Just wanted to touch upon something that we see very often here at the clinic. People are always curious what kinds of conditions we're treating. One of the most common things that we treat in the clinic is low back discomfort. And it comes from a lot of different people come in here for a lot of different reasons with low back pain. Sometimes it's a sport injury, sometimes it's just sitting for long periods of time at their desk without getting up to stretch and move. Sometimes it's shoveling. So this recently here in Southern Ontario, we had a lot of snow, and so a lot of our patients were coming in with injuries from shoveling. And one of the most common things that I ask and that I see is that people are not warming up to do their shoveling. And shoveling should really be approached as an exercise, a type of movement and a type of exercise. So when we're exercising, we should be warming up. So I always tell my patients, before you start shoveling, if you can, maybe walk around your house a couple of times, or go up and down your stairs a few times just to get the blood flowing and the cardiovascular system moving. And then I'll just tell them to do simple things like a little bit of squatting, a little bit of bending forward to warm up the back, maybe a little bit of twisting. Our back is pretty weak when it comes to twisting, especially our lower back, so we want to make sure that it's used to that movement before we start picking things up. And then of course posture during shoveling is very important. So the idea of keeping our back straight, using our knees, and really pushing as much as we can rather than lifting things. So with the warm-up and a little bit of postural advice, people are able to usually shovel without hurting themselves. When they do come in here with low back pain, depending on what it is, we are assessing to see what needs to be done. Sometimes it's a little bit of muscle work, some modalities like ultrasound or acupuncture or interferential current. Sometimes it's a little bit of advice on how to stretch and do their exercises. But we have a lot of different options depending on who we're seeing and what their age is. If you have any other questions, feel free to reach out.